It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, my friends, is COVID-19 driving you crazy? It's driving everybody crazy, right? It's something. We're scratching our heads. We're trying to do the best that we can, and today's show is to give you an update of what's happening. You couldn't find it from the information from Finder People. I have John Fletcher, no stranger to the area, president of the LVH-Hazleton. Dr. Valente is here. He's the chief medical officer. And Jodi Lenko. Dr. Lenko is the assistant medical director. Give me some updates what's happening so we could at least live some kind of a normal life, right, John?
Somewhat, yes. Let's hope we get back to normal life at some period.
This is something that is unbelievable.
It is,
I mean, it's
yeah.
just, but you know, I guess we cope with it, you know, and it's wonderful that we have the information that the hospital keeps giving us every day. So give us sort of like a update what's happening right now currently.
Sure, absolutely. So first off, I want to say thank you to the community because their response to the request that we made of them to social distance, wear your mask, has really helped us in flattening the curve. If you remember, we had a peak. We were hit hard when the first wave of COVID came along, end of March, early April. We were seeing both our outpatient testing sites seeing well over 100 positives a day. Many days 125, 130 positive COVID tests. And that was for a short period. And I give credit to our community for responding, for doing the things they needed to do, because as soon as that peaked, it flattened relatively quickly. But it was a short time period for the peak. And then we experienced a time period where things were going well. We had our initial increase in our inpatient admissions. I know Dr. Valente is going to share a little bit of that information with you, but then it calmed down. We were on a pretty good track. We were seeing single digits number of positives in our outpatient testing centers for a good period of time. Most of May, good part of April. June was a really good month. Sometimes we didn't have any. We had 0 positives at our testing sites. And July, we started off well. I walked into the office one day. Every day we get a report. And that report consists of the number of positives at our testing site, as well as what our inpatient census looks like. And our outpatient report was showing a little bit of a spike in the number of positives in our outpatient, right around the July 24th timeframe. And so we all got together and had a discussion of what's going on. And we saw that spike continue. Now, it wasn't the 100 plus. It went from single digits to sometimes in the higher teens and then into the 20s. Mm-hmm. But it was a significant increase to what we were seeing in the prior months, and we were concerned. And so when we looked at the information, what we saw is, one, the number of people we were testing at our sites almost doubled. We were doing 40 or 50 tests a day on people who, whether they had symptoms or not, that's about the number we were testing. And that jumped to many days well over 100 that we were testing. And more people without symptoms than with symptoms, or about 50-50, a little bit of a change. We looked at where they were coming from as a percentage of our total. And what we saw is that Hazleton and West Hazleton, as a percentage of total, actually increased from what our peak period was. The other communities were actually going down as a percentage of our total. And so obviously we had an increase we saw in both the Hazleton and West Hazleton areas as a percentage of our total patients. The good news, a couple of good points I want to make.
Thank God.
Yeah, there's good news. The good news is we have not seen an increase in our hospital admissions. Okay. And so people, even though they were testing positive, were not getting sick enough to be admitted. And I know Dr. Valente is going to discuss that a little bit. And as well as what we saw is the average age of the person testing positive, where it was 47 during our peak period, it's 34, 35. And so it's a younger group. More people that are asymptomatic were being tested than we saw, and it wasn't leading to the admissions. Now, our concern is the spread. So even though it's that 34, 35-year-old that's testing positive, we want to make sure that they're not going to spread that to a family member, an elderly family member. And so that was really, we wanted to make sure we got that message out. And so that's kind of what we're seeing in Hazleton.
What caused the trend? I mean, what was it that spiked it?
Well, so there's a variety of reasons, and honestly, I think Dr. Lenko will jump into that. She spent many days and continues to spend days at our testing center. We were seeing an increase in people that were requesting testing for travel, for return to work, and so we saw that increase in those specific areas, and so it was concerning. We put together, as you know, we talked about our task force that we had established, and we immediately, within days of when we saw that first spike, we brought the task force together about what the message is that we want to send to the community. And that task force has done a tremendous job, whether it was during the first peak period in helping us educate the community, and they continue to do that.
What did the task force tell the community?
So the task force, the initial task force, what we wanted to do is get the information about social distancing. If you remember back in the end of March and early April, masks were not, people were not utilizing their masks. They weren't staying 6 feet apart. We were all learning about what we needed to do. And some reports were saying mask not important. Then it turned around, mask is important. Stay your 6 feet away. And so we really wanted to educate the community on what they needed to do, as well as the industries. I mean, it was new for all of us. And I think when we saw our first peak, our first end of April, early March, again, the industries were learning as well. Can you imagine going to work and where you're actually standing shoulder to shoulder, whether you're standing in line for the time clock or your breaks? So I will tell you, the industries did an incredible job at responding and helping us flatten that curve. So we want to make sure that where we are today, that if it continues to see an increase, although we're seeing a little bit of a decline right now in our positives, what we don't want is we do not want that to lead to hospital admissions.
Yes.
And so that's the critical message of what we
So
need to
some
get out.
employers are requiring 14 days self-quarantine if they're traveling. Okay, is the hospital requiring that?
Absolutely. And so what we've done is we basically said on the Pennsylvania Department of Health website, they have listed states that are high-risk states. And so our policy is that if you are traveling or vacationing in one of these states, you must quarantine for 14 days. And so it's been tough because you have people who've made vacation plans last year, whether they're renting a home in one of those hot spots. But no, we've implemented that policy. And I will tell you that our colleagues at the hospital and at the Health and Wellness Center and LVPG have followed that. Many have canceled their vacations just because they know that they're here to serve the Hazleton community, and it's critical.
The last show we did at the hospital, we talked about the safety precautions that the hospital is taking. So let's review to the public. So because again, I think after last show, people understood that the hospital's safe. Okay?
The hospital's safe.
It's safe. So what's going on? What are you still doing?
So every single person that enters our facility has a temperature check. We ask them a series of questions. They're pretty standard questions. All of our employees, all of our colleagues are responsible for answering questions before they enter the workplace. The cleaning we've increased, of course, our cleaning and how we handle that. We have it as a work site, because the last thing we need is to see that spread with our colleagues. Can you imagine if we saw the spread within the hospital? So we basically closed the cafeteria for anyone that wants to gather in the cafeteria. We've looked at all of our break areas and removed chairs. We've asked people that if they're going to take their breaks to either do it in an isolated area by yourself. And it's tough because you know what? We all want to be with each other. Sure. There's no ands, ifs, or buts about it. But we've implemented all of those procedures. And I will tell you, I'm very proud of our colleagues that they followed it, both in our outpatient sites and our LVPG practices, as well as the hospital.
And I'll tell you something. We had to go into some of the facilities to do something, and the people's attitudes are fabulous, okay? And I can imagine being in mask all day and the frustrations, etc. With all that going on, John, they've just, the hospital people have been just great. You know?
And they have done, you know, I said this before, they never blinked.
Yeah.
Whether that was at the end of April and early March, where it was, you know, at our peak, they never blinked. They knew they were here to take care of our community, and they did just that.
Yeah. I have to tell you one thing. I was just talking to Dr. Lenko about a friend of mine who just recently had something go wrong with him, and he and his wife could not stop bragging about the care that they got out the hospital. Okay, and I mean, he just says, Sam, you know, I listen to all your shows with the hospital, talk about the doctors and the people. He said, but I've lived it, and he said they were just the wife. I mean, it's good to hear stuff like that.
It's great to hear
Yeah.
that, because you know what, we always hear the other, right?
Of course, yeah.
And let me tell you something else. Here's the amazing part. You know, we do patient satisfaction surveys every month.
Yes.
And through this experience, our patient satisfaction scores went through the roof.
Yeah.
And so, you know, not only are they feeling the pressure of what they do at work, but they're also dealing with health care issues with their kids, they're dealing with the school issues, they're dealing with all that at home. Yeah. But they know that they're here to take care of the patients.
So I mean, they didn't get my survey on Valente because I put all bad.
Me too.
Well, folks, that's John Fletcher giving us an update, president of LVH-Hazleton. Coming up, my good friend Dr. Valente and Dr. Lenko will be here to fill us in what's going on. But it's education. We'll get through it. We have to just keep our heads up and be positive. We'll be back right after these messages. Welcome back to the Sam Lesante Show, folks. SSPTV.com. That's where we produce. You can see all of our shows, 21 shows we produce. I want to thank all of you in Pottsville, Wilkes-Barre, and Scranton for the surveys that we had in the last couple of weeks. Very happy to say, very proud to say that we have 100,000 people watching the Sam Lesante Show every week. The girls, 90-some thousand. It's Your Health, up to 80-some thousand a week, and we appreciate that very much. We're giving an update today on the COVID-19. I have the people here. We just heard from the president, John Fletcher, and now we have Dr. Valente. He's the chief medical officer. Tony, nice to see you.
Nice to see you, Sam.
I opened the show saying this is craziness. When's the craziness going to stop? You know, but we have to live through it, isn't it?
Correct, yeah. Nobody knows.
No, it's just something. I mean, I guess you're learning something as days are going on, right?
Well, it's absolutely right. I mean, this is the first disease in my career that there's really no book. You know, it's the first one ever, you know, that we're treating and kind of learning as we go.
Inpatient side. Let's look at what's happening on the inpatient side in the hospital. Increase versus no increase, increase in patients. What's happening in patients?
Well, yeah, I guess that's part of the good news, and I'm happy to say that really the inpatient side has been quiet. I don't want to jinx ourselves, but we've been very quiet both in the ED and in the hospital. You know, folks coming to the ED with symptoms, and also people requiring admission. It's been quiet. Right now we have 2 people in the hospital with COVID. We have nobody on ventilators, and that's been basically the case for the last number of weeks. I know John was speaking about the uptick that we saw in the outpatient testing and the outpatient positivity rate. But that has not translated into inpatient admissions.
Okay, so who gets tested? I mean, if people are watching, the show now and they, they just want to get a test to see if they have it. I mean, I know that any surgeries that are performed, everyone has to get the test, right?
Yeah, there's pre-op testing.
So what happens that people are coming, they just want to find out if they have COVID, if they travel someplace, or how does that work?
Well, the majority are number one, people with symptoms, obviously, and you've heard that list of symptoms ad nauseum at this point. Cough, shortness of breath, myalgias, that type of thing. There's also folks that come in without symptoms, for example, if they want to travel to a state that requires a test usually within 72 hours of entering that state, or a foreign country. Some people need a test to get back to work. If they've had an exposure, they'll get tested. even if they don't have symptoms. If they've just had a close exposure with somebody, they may want to get tested. So they come in either with or without symptoms, I guess, is the answer.
Could you, if someone just wants to get tested?
They can. I think Jodi can speak more to that exactly, you know, who we're testing right now.
Okay. Now, the hospital's done a fabulous job. There's no question about that. Are you prepared, God forbid, for another COVID-19 spike?
Absolutely. And I think I'm happy to say that I think we'll be more prepared. Remember, last time we didn't know what to expect.
Yeah.
You know, knock on wood, we came out of it, you know, unscathed. I think we did very well. Our numbers were good. Our outcomes were good, better than expected, really. Also, I know we kept everybody safe, which is of paramount importance. We had no shortage of PPE. I never felt the least bit threatened, you know, at work. I always had adequate PPE on myself, and I know everybody else did with me. So, but now we also have a little bit of experience behind our belt, and now we know a little bit more what to expect. And so we're not going in with that same. There was a lot of trepidation at first, because really, you know, you were like opening a door and you didn't know what was really in the room.
Okay. So if you're experiencing any kind of symptoms that you feel, you know, is concerning, you should hit the ER.
Absolutely. You know, I would say, don't be afraid to go to the ED. You know, we had this conversation before up at the hospital, I guess a couple months back. We certainly don't want people to feel the least bit threatened about going to the ED. It is absolutely, completely safe. Number one, we've done a lot of procedures, and we have a lot of policies in place in the ED to keep people safe. And number two, just the sheer numbers of people coming in there with COVID-like symptoms is relatively low right now, dramatically lower than it was back in March and April. So absolutely, and not just COVID symptoms, Sam. You know, we want to make sure people come into the ED when they have other symptoms. If you know, one of the theories is that COVID-related deaths are a lot higher than what's been reported, because there's a lot of people that probably passed away of other diseases.
Yes.
Because they didn't go get medical attention.
Yes.
The theory is that in the United States, as opposed to 170, we're closer to maybe 210 or so because of the COVID-related disease.
Inpatient, you know, we talked about, you know, the craziness that's happening, and people, you know, being home and shut-ins, and you know, are experiencing any additional mental, you know, or how should I say? Sometimes, you know, when you get nervous and
Sure. Absolutely. I myself, Sam, fortunately, I don't see that, but it's absolutely there. It's well documented.
Yeah.
There's absolutely that phenomena going
elder
on
abuse
with
is
people.
up, child abuse is up,
Domestic abuse is up.
Yeah.
All of the things that you would think of. People with depression and anxiety doing worse. That's well documented.
What words of encouragement, Tony, could you give the community? I mean, we all wish we had that magic wand and let it disappear,
away.
and I hope it does go away. But what do you tell the community? I mean,
well, I think first and foremost this is a controllable situation if everybody plays the game right. It is very controllable. We could cut down transmission by about 80% if everybody simply wore a mask. That number's been well documented. It's about 80% in a decrease in transmission. So if everybody plays the game right, we could really put a dent in this and mitigate the spread right there. In addition to that, our treatments for it are better. We now know that dexamethasone works. We know remdesivir works. Work on a vaccine, there's at least 4 candidates right now that are in phase 3 clinical trials with about 30,000 people in each trial. So we should have a vaccine over the next little while. I'll say I don't want to pin myself down because nobody knows, but you know, there's chatter
would you
about
take
maybe
the shot?
end of
Will
the
you
year.
take the vaccine?
Would I take the vaccine? I think so, yes, absolutely. I think it's well worth it. And as a matter of fact, that's probably the people they're going to go to first would be, you know, frontline workers. Yeah.
All I could say, Tony, is keep the good work up there, and I mean that sincerely. You guys you're all doing fabulous. I mean, our hospital is just second to none. I've been saying it for many years. It's second to none. That's Dr. Valente, he's the Chief Medical Officer. Now we're going to hear from the boss coming up, Dr. Lenko. She's going to tell you what to do, and you better do it. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. Remember, 24/7, ssptv.com. You can get all of our information. Give you an update. We're giving you an update today, COVID-19, what's happening. We had John Fletcher here, Dr. Valente, and now we're Dr. Lenko. First time I'm meeting you, right? This is the first time?
First or second, I think.
Second,
Yeah.
okay. And your father is Dr.
Mike Wyszynski.
Mike Wyszynski.
Yep.
Great guy.
Yep. He's
Great
been
guy.
here for
Great guy.
since 1977.
Yeah. And you're like 23 years old. That's fantastic. Doctor, we're talking about COVID and some questions I have. What does it mean to be asymptomatic or symptomatic?
Yeah, I think it's a good question because a lot of people get a little bit confused when we're talking about that. So symptomatic simply means that you have some symptoms, and it could be any symptoms. They could be mild, and specifically to COVID, we're talking about cough, fever, sore throat, trouble breathing, things like that. When we refer to asymptomatic with the letter A in front of it, it simply means you don't have symptoms. So it's an important differentiation because you are more likely to test positive for the disease if you do have symptoms. But we've heard a lot about, from the CDC about what they're called asymptomatic carriers. That simply means that people are walking around in the community and don't have any symptoms, so it's harder to pick up those cases because they simply don't have symptoms and you wouldn't really suspect that you have the disease.
So if someone has asymptomatic, if they're asymptomatic, that means nothing's happening. They're not getting sick.
Correct. Yeah, they might not
But they
have
can
anything.
spread it.
They could still spread it, and
how
that's
do you control that?
This is one of the difficulties we have in the country right now because we're not quite testing as many people as we should be. So we would like to be testing a lot more, especially in the state of Pennsylvania. We're at about a little bit less than half of what we should be testing overall, but we have some limitations in that just because of the number of people that we can test. But the best thing that we can do to avoid those asymptomatic spread is to do everything that we've heard about from the CDC. Wear your masks. Make sure you're staying about 6 feet apart from people, staying away from large crowds, especially indoor crowds. So those are the ways that we can help control it, even if you don't know that you're the carrier.
Will they be coming out, do you think, with, for example, the work or school or after you travel, will they be coming out with mandatory tests that you should be getting tested?
So that's dependent on the organization and your school or your institution and your employer. We've seen that already, so certain colleges are requiring that
The test
students.
itself, okay,
Yeah.
they tell me there's different tests. Are there different type of tests?
There are a few different types
What
of
do we
assays.
have?
So the type of test that the hospital is doing and Lehigh Valley Health Network is doing through our lab, which is called Health Network Laboratories, is a PCR-based test, and it's a nose swab test. There are some other tests on the market that include saliva and that are more rapid-based. We don't have those available to us yet, mostly because we feel that this PCR test that we're using is the most accurate and the most effective way at picking up the disease.
Now, does it take 2 weeks to get results?
It's variable, but right now we're seeing a much quicker turnaround time. It does depend on the number of tests that we are ordering in a day. So H&L, our lab, has the capacity of doing about, I'd say, about 1,500 tests per day. So depending on how many tests are ordered within our network per day, we're getting a pretty good turnaround time, but it can vary depending on the supply chain issues and if we have enough.
What has been the average?
I'd say right now for the past couple weeks we're averaging somewhere between 3 to 5 days.
Yeah, because
Yeah, it's better than, I mean, we've been better, we've been worse.
Yeah.
So we're doing everything that we can to make it as quick as possible.
you think you'll be getting these 15-minute tests coming in?
I hope so, but we're not at the point.
If you had that, you think you'd get more people coming in?
I think we would utilize it more, sure, and it would be helpful, to have that answer right away.
Okay, so self-quarantine, what does that mean? Do I
Yeah,
put
so-
myself in the corner and have no one talk to me for 2 weeks? I know Valente would like that, but it's not going to happen.
So self-quarantine is a very useful tool that we use. So specifically for people that have traveled from a, we quote, hotspot state, or if you've had an exposure. So if you've been in close contact, closer than we are right now, with somebody that you know that's had COVID, we ask that you self-quarantine, and that means you stay in your house. It means you shouldn't be going to the grocery store, you shouldn't be going to work, you shouldn't be exposing yourself to anybody outside of your home. So I think it's really important to understand that and know what that means, because it's your responsibility to do that to protect the community around you.
Okay, so what does the mask do?
So the mask does a couple things, and most importantly, when we're wearing the cloth masks at the public, it is protecting others around you. It's protecting them if you cough, if you sneeze, and just from talking, there is saliva, and that's where the virus is transmitted. So the masks are really designed to be protective of everybody else around you, not so much protective of you. So if everybody wears their mask, then you're protected too.
What about the 6 feet stuff?
So the 6 feet has to do with how far the virus can transmit. The farther away, the better. They've done studies on this as well, that 6 feet is better than 3 feet, 12 feet is better than 6. So that's why we encourage everybody to avoid large crowds, avoid crowded places where you can't maintain that social distance, especially indoors.
What kind of mask? There's different kind of masks that are out there.
They recommend at least 2 layers of cloth. So if you have a cloth mask that you're wearing out in public, and that basically means anytime you leave the house when you're going to be exposed to anybody, at least 2 layers of cloth. There's been some discussion about face masks, and unfortunately, face masks are not quite enough. They are useful in addition to a mask, but they are not a substitute for a mask.
So a cloth mask?
A cloth mask is sufficient as long as it's at least 2 layers to wear out in public. Yes, to protect everybody else around you.
So what do you think the future looks like?
I wish I had that magic
Come on
ball.
now, give me some good news here.
I think we're doing, as John mentioned already, the community response here has been tremendous, and I think we can continue to mitigate this disease. We have seen a slight increase in our cases recently. We can't let our guard down, and I think that's what I've been preaching to our members of our medical group here too, is that we have to wear our masks. In our offices, we wear our masks all the time. I think we just have to make sure we are doing everything we possibly can. There is what we call COVID fatigue. We get tired of it after a while, but it's not gone away. It's not going to go away in the near future, and we have to do everything we can to mostly protect our elderly.
So what medical words of advice do you have for our viewers?
So I think that's basic. I think that's what I would say is making sure you are taking everything, every action you take, make sure you're thinking about it. Try not to let your guard down, and most importantly, make sure you're taking care of your loved ones. You mentioned earlier about people at risk for domestic abuse and domestic violence and elder abuse. Those are the people that need extra attention, and that's who we're trying to prevent from going into the hospital. You
have the frustrations of trying to provide for your family, the frustrations of maybe you're not working now, and then you have it just keeps piling up. So there has to be some areas.
It's hard, but make sure you remember we're all in this together.
Oh yes.
And everybody lean on your friends, your family, your loved ones, and the other important thing is make sure that you have contact with your primary care doctor, and you have a primary care doctor. If you don't, reach out to Lehigh Valley and we will get you one.
And you got a lot of good ones too. It was nice meeting you.
Nice meeting you too.
To give your dad my best.
All right, well, thank
He's
you.
a great person, he really is. Folks, I'll give you an update on COVID-19. Follow the rules. We'll get to it, as they say, just follow the rules. You couldn't find better information coming from Lehigh Valley Hospital Network. They've just been great. So if there's any questions you have, the number is 888-402-5846. Just give them a call. Well, what's this over the phone COVID screening?
So that is what you just mentioned there is actually our 24-hour-a-day, 7-day-a-week nurse hotline. So if you have any questions, if you were exposed, if you have a question about where you were, that's a 24-hour-a-day. You do not need to you don't have to have insurance, you don't need to have a doctor in the network. You can call that nurse hotline 24 hours a day, 7 days a week.
Let me give you the number again, folks. It's 888-402-5846. This is great.
It's fantastic. It's a great resource, and they can guide you to a primary care doc. They can guide you to a testing site if you need it. It's fantastic.
The hospital never ceases to amaze me. I tell you, this is great. Okay, thanks for coming on the show.
No problem.
Remember, folks, stay safe. We'll see you next time.